My breast surgery experience spans 20 years. In the past, I've also had a co-directorship at the Valley Medical Center Breast Center. I've done over 500 breast surgery cases, including management of over 100 breast cancer cases. As a general surgeon with a special interest in breast surgery, I offer the same surgical capabilities as a breast surgeon, only I also do other types of surgeries, basically the same skill set except a broader set of skill sets. Yes, over the past 2 decades, there have been a good number of very important advances that affect and improve on the care that we can provide our breast cancer patients. One of them is clearly that instead of mastectomy, we can offer lumpectomy, breast conservation with postoperative radiation therapy to the majority of our patients. Another advent has been the use of MRI and how high-risk patients can now be screened for breast cancers that are not picked up by regular mammograms. Additionally, we use the MRI for patients who are diagnosed with breast cancers, but we are also looking for additional occult lesions, and that's been an adjunct to our management that's improved the care for our patients. Another improvement is really a major improvement in preventing lymphedema, which was associated with axillary dissection and staging for breast cancer. And so instead of removing the 10 to 20 lymph nodes under the arm in order to randomly find the lymph node that might be involved, we can now do sentinel lymph node biopsy, which is a very small incision, minimally invasive, and can be done as an outpatient procedure. So when a patient is newly diagnosed with breast cancer, there's a lot of fear and anxiety that's really associated with the unknown. So our office makes it a priority to bring those patients in within a week of their diagnosis and provide information, come up with a treatment plan, and have that started right away within a week. If a case is appropriate for an ambulatory or outpatient non-hospital setting, I believe that an outpatient surgery center has benefits to the patients, such as timeliness, lower infection rates, and even a cost benefit for the patient. I think what makes a great surgeon involves skill, dedication, and true compassion for the patients.